I know any needle you get or puncture of the skin, there's always a possibility of an infection, but I never dreamt of sepsis. He said I would be dancing that night. He was quite confident there was going to be no problem.
So Anne called our firm after she'd had a very bad infection following an epidural injection that she had at the Rothbard Center. And she didn't know, frankly, whether the Rothbard Center had made an error or not. All she knew is she went in for a routine pain injection and came out with a very, very serious injury.
I can't stand for any length of time, and I can't lay down for any length of time. It's just unbearable sometimes. The worst is the incontinence.
It's my opinion that this was a black swan event, a very rare event which nobody believed could happen.
For 2 years, I was trying to get information about what or why I got the infection. Now, we had put a letter in of complaint to the College of Physicians. They still haven't finished their investigation. Toronto Public Health, they obviously finished their investigation fairly quickly, but when I phoned, nobody would give me information about it, and it wasn't until just recently that I found out about the Freedom of Information Act.
The Freedom of Information request was 1,200 some odd pages. It was full of technical jargon which we were able to work with Anne to help her understand, but for the average person would be undecipherable. She was really put to an enormous effort to get some straightforward answers, which in my view, she should have been told by the doctor, she should have been told by public health.
The cause was Staph aureus infection. They swabbed his face, they swabbed his nose, his mouth, and he had infections everywhere. But he was asymptomatic. He had no knowledge of that. Stephen James is certainly very, very distressed and very anxious and very upset about the patients because he's a very dedicated doctor.
The College of Physicians and Surgeons of Ontario protects and promotes the health and safety of the public, but now we are looking to make our processes transparent whenever possible. And so, at the end of the year, we decided to make available the results of our inspections. It allows patients to make informed decisions about their care, and that is important.
Well, when Anne looked on the website with respect to this clinic, it looked like the clinic had no problems whatsoever. The college is not providing the sort of information, basic information, which the public has a right to know. The broader issue is we need to have greater transparency of the inspections that take place. And it's simple. When Toronto Public Health does an investigation of an outbreak, in the same way an investigation when an airline crash happens, that investigation needs to be made public. In addition, when the regulator, the college, goes in and does an inspection, just like Toronto Public Health when they investigate a restaurant, they need to make the results of those inspections public. Those are two easy steps which are going to prevent future harm from happening. And there's really no reason not to do those two things.
We're horrified and feel terrible about this. I've had I would like to think, a very decent career. At this stage of my life, to have something disastrous like this is very unsettling.
I would like to see, changes that make the system safer so that people don't get harmed. And in this case, this could easily have been prevented with adequate inspections beforehand. And when the first case of an infection became known at the clinic, if rigorous changes had been made at that time, we wouldn't have had 9 people who ultimately got infected as a result of this.
My life? It's affected my whole family's life. I would like to see the doctor lose his license. I don't want to see him hurt someone else. And if it was because of unsterile conditions, my good God, that's unbelievable.